So Muse has been in market as an EEG device actually for decades. So we first came out in 2014, and we are both used widely by consumers to learn to meditate and now sleep, as well as by scientists. So there are over 200 published studies using Muse. So that means literally thousands of researchers use Muse for their research. Some of them use it for EEG research, both in lab and out of the lab. Some of them use it for meditation research to actually be able to implement a meditation protocol inside of a study, and some of them use it for sleep research. The pure sleep research is the newest kind of research that we have. We developed Muse S, and then Muse S was taken up and validated by the research community. So most of those studies have just begun. But if you go to our website, choosemuse.com, and you look under research, you can see some of the many studies that have already been published. And those range from, so I mentioned Mayo Clinic. So Mayo Clinic did their initial study with Muse in 2015, they started it, and they used Muse meditation for breast cancer patients awaiting surgery, and demonstrated that by meditating with Muse and using neurofeedback, they were able to improve the cancer care process by decreasing their stress and fatigue and improving their quality of life. Since then, Mayo has embarked in probably 7 other studies with Muse in a broad range of different conditions. One that is more recently published is on Cushing syndrome. That there was a conference paper that came out demonstrating it improves symptoms in that stress-related illness. Mayo Clinic even did a study with their own doctors using Muse. So during the pandemic, they had 50 of their healthcare professionals using Muse, both its meditation and sleep intervention capabilities, like the digital sleeping pill. And the doctors had a 54% decrease in burnout while working in the ER during the pandemic, and also improvements in resilience, cognitive function, and sleep. So, there's been a ton of published studies with Muse, and many more that will be coming out over the following years, including one from Mayo Clinic on long COVID. So they had long COVID patients using Muse, and I've seen the data because we're now doing a partner study with them for the next phase of the project. But the data is going to come to publication very shortly, and it is highly positive, so much so that using Muse is one of their main recommendations, like core recommendations in their long COVID protocol.
All right. Well, there's some encouraging things happening there, and in particular, helping people with their quality of life, which is that's why we're here at A Longer Life, honestly, is to help people, in particular, avoid the diseases of aging and reduce human suffering in that way, by empowering people with information about their health and to leverage technologies that can help them be healthier. So let's take a forward-looking view here with EEG technology, wearable headband from Muse. Where will this go in the future over the next 5 to 10 years in terms of continuing to improve human health? Is there another headband that you need to build to take on another problem, or is it integrating it with other technologies so that it becomes more effective? Tell us in brief, your vision.
Sure. So 5 to 10 years is a long time out. I don't actually need to go that far. So the existing device that we have, the Muse S, really does, so many things that we want it to do, and it's really become a core tool for brain health.